I've been messaged over 20 times about this video, and people are asking, Doctor, is what they did to this patient okay? Look at her natural teeth and how they shaved them down to make a bridge. I'm going to give my opinion since I've been asked so much, but I want you to know that I don't know the details of this case. I'll give my opinion based on what I see and we'll reach a conclusion. From what we can see, this person has two completely healthy teeth. This lateral incisor looks great, this premolar does too, and a canine is missing. And of course, the lady probably wanted something permanent, something she wouldn't have to take in and out. So they opted to shave the teeth down. Normally, what we dentists do is shave down the adjacent teeth to replace the gap with a bridge that has a tooth in the middle. This was done a lot in the past when dental implants didn't exist, and it was the only permanent solution to have a tooth attached between two others. Another very interesting option is the Maryland bridge, which has two wings and is bonded to the back of the teeth. That helps a lot when using an adhesive technique. However, for canines, it's very difficult due to the angle and the limited space in the bite. We can see here how the premolar fits perfectly with the bottom one, and the lateral incisor has almost no space. So doing a canine with a Maryland bridge would have been quite complicated in this case, and would likely have kept coming loose. Anyway, the point is that in this case, they decided to shave him down. They shaved this tooth and they shaved the other tooth. Here we see how they're using the drill to create a circumference. For what? So a small bridge can fit. And then they put in this temporary one, which many people also urge me to talk about. And yes, indeed, a temporary should be like a preview of what's coming from the lab. But there's something very important. It must always be well sealed and shouldn't have edges like these because they can trap food, and by the time the final prosthesis arrives, the gums will be very inflamed, which can make cementing it difficult. And then, well, they don't show us the after. It just stops at the temporary and says, the after is coming soon. Now, if you follow me, you know that this is, of course, always the last option for me. Why? Because there's clearly a much more conservative option where you don't touch the adjacent teeth at all. You place a dental implant in the bone between the teeth and then a crown, and the neighboring teeth aren't even affected by it. Of course, there's the price factor, which is important. However, there isn't much difference nowadays between getting a dental implant with a crown versus a bridge. Obviously, the dental implant is more expensive, but there's another very important cost called the biological cost, which is destroying two teeth to replace one. And that's up to each individual. But one point that many people miss is that not all patients can have dental implants. As we said, one is the price, but the other, which is also very important, is the patient's health. And if we look at this case in a bit more detail, notice how the patient is missing all of her molars. What does it mean? That the patient was likely a smoker who had periodontal disease, and she's already lost quite a few molars, even, right? On this side, and she's missing another one here too. So we're talking about a patient who likely has some systemic disease that's causing her to lose her teeth. And surely, or probably, the doctor who did this work knew that the patient wasn't a candidate for implants, and that's why they chose to do a bridge. And the thing is, friends, this happens very often. Many patients either don't want dental implants or can't afford them, or don't have the health to get them, and they leave us with few options to replace a tooth in the front, because of course, nobody wants a removable appliance, at least in the front. Now, when it's a matter of price, we always try to convince the patient to get something removable while they save up, while someone lends them money, or while they take out a loan. Why? Because once these teeth are ground down, you can't go back to having that beautiful enamel they once had. And it's a real shame to have to do this grinding, especially since they're not just going to spend 10 pesos on a bridge either. The bridge also has a cost. So it's not like they have to save up from scratch. If they can already afford a bridge, the difference between the bridge and the implant isn't that much anymore. But what about patients who are smokers? What about patients who take bisphosphonates, which are those medications for bones? What about those patients who have just undergone radiation for cancer? What about those patients who have vitamin D deficiency with metabolic syndrome issues, uncontrolled diabetes problems, who want to have something fixed in the front? Of course, they're offered this option first, which is an adhesive option, but if they were offered this, it was cemented and it keeps falling out because the bite won't allow it. Sometimes we have no choice but to do a dental bridge. And the saddest part of all is this graph I'm going to show you about my clinic. where we classify patients using a scale we created based on how viable or not viable it is to treat a patient according to their systemic health. We have a scale called the Bana scale, and it goes from EB0 to EB5. EB0, EB1 are very healthy patients we can treat without any problem, but EB2 and EB3 are patients who already require some medical intervention before doing a dental treatment to have a higher probability of success. And of course, EB4 and EB5 are patients we shouldn't be treating, and they should be in a hospital or under medical care. And if we look, the vast majority of patients, that is 90% of all these patients, are from EB2 and up. What does that mean? That many patients do have some systemic disease or several systemic diseases that we should be treating before seeing them. And mind you, we perform a retinography check on them to see the blood microcirculation. We ask them for a fairly complete blood test that allows us to understand, well, how the patient is systemically. And once we have all those data, along with the clinical history, we obtain a score on the Bana scale. And besides the Bana scale, it gives us a treatment viability index. For example, how likely it is that they'll do well or poorly with dental procedures, with surgery or implants, and with orthodontics. For example, this patient, who is an EB4, has a 10% viability for dental implants or surgery, meaning we almost can't touch her until she has all of this under control. And sometimes we're lucky enough to have EB0 patients, meaning you can really do any treatment and there shouldn't be any complications, at least systemic or medical. The software even helps us understand what each value is. Why? Because what is LDL cholesterol? Well, here's the explanation: what happens when it's high, when it's low, how it affects the dental part, and how we can explain to the patient what it means if it's high or low, right? So with all this review we do for patients, we can now classify them and know how viable or not viable it is to treat them. And returning to this case, maybe this patient was an EB3 or an EB4, where a dental implant couldn't be done and therefore they opted for a bridge, a fixed one. So friend, I know when you see this, you say, what on earth did they do? Poor thing, they destroyed healthy teeth. Yes, indeed, they are healthy teeth and they have to be sacrificed in some way. But if we understand the full context of the cases, we know that not all cases can be resolved with a dental implant, even though we'd love to. Why? Because it's the most conservative option there is. And here's the beauty of dentistry, that we have so many treatments, and each treatment applies to different patients. There are treatments that can be done without any problem for patients. There are treatments that we definitely can't do, and we have to choose slightly more aggressive options. But in the end, they'll give our patient quality of life. And now you see why it's hard to answer these questions, because we don't know the context behind the patient, and therefore we always have to see what happened with that patient, what the patient wanted, how the patient's health was. And well, I hope that after this video, you have a bit more of an idea of everything we dentists have to review to be able to make a decision on a treatment plan. If you want to see more videos like these, don't forget to follow me and share this video so it reaches more people, and they can understand a bit more about the treatments we dentists do. See you in the next video, and I hope you're doing very, very well.